I'm just kind of curious in terms of, peer mental support and peer mental health support, and just kind of looking at the movement currently. I'm wondering if we can speak to what it's looking like in the BIPOC or BIPOC communities currently. In terms of benefits and hardships, and just, are there any particular moments that you could describe as a peer specialist where you were able to reach a client using, the services that you provide? And Chris, we're going to start with you on this one.
Yeah, this brings me back to a study from several decades ago, and it was in a neighboring county, and they said, well, those Japanese clients, they only like to talk to each other. They don't come in for services. So a researcher says, I'm going to research this and I'm going to save this community and I'm going to bring them out from their family. And so he looked into it and he found out that there were 0 providers in Alameda who spoke Japanese. So of course they're talking to each other. There was nobody like them to talk to. And literally they couldn't talk to the people in the study, couldn't talk to the providers. And so what we have with peer mental health, which really is to elevate a diversity of voices, a diversity of cultures, and bring them into the treatment team table as equals. That was really important when Hume got into peer mental health in 2014. We had kind of looked around and people were looking down at them saying, well, you're just going to do outreach and then we'll kind of do all the real work. Well, we found that people hadn't really been training their peer specialists on clinical boundaries, to be a clinician from a peer mental health standpoint, to understand that that relationship. And so we brought them into the same level as the rest of us, and really started to get a greater diversity around the table. And that's important because people of different cultures than yourself, you might look at their behavior and say, oh, that's a mental health disorder. Let me help you and save you. And really you're just looking at difference that you don't understand. So the more you bring onto the team. Also, people want to talk to people that look like them, that have the same experience or similar experiences. Mental health now is becoming more diverse, but we come from a history of old white dudes, and we're in the middle of that transition. I'm excited about the future, but we're definitely not there. A lot of us aren't caring about the stats that show higher rates of going to the hospital in certain groups than other groups. People still have to yell about that. People still have to bring attention to that. And so we're definitely not there. And so we need to elevate as many voices onto this as possible. And peer mental health brings in that lived experience from those areas, and it'll hopefully bring in the healing. Whereas before, someone would go to the doctor's office and say, you don't get me, and then go home and they'd be called a problem. Well, now they're going to go and see someone hopefully that looks like them. Could be the therapist, could be the psychiatrist, but the more we have peer mental health right on the ground on the engagement side and the treatment side, I think it's going to bring a lot of healing in where there was blame.